Hi, I'm Aaron Zolbrod. Welcome back to part 4 of my Medicare Reset Series designed to help those who are already on Medicare prepare for AEP and also those who are going to be new to Medicare prepare as well. The question for today is what are the pros and cons of both Medicare supplements and Advantage plans? We're going to split this into two different webcasts because they're a little bit long, but we're going to start with the pros and cons of Medicare supplements, which are also known as Medigap policies. We're going to talk about that, why that's such a great name here in just a moment. So Medigap policies, let's start with the cost, and they're going to run between $80 and $100 a month, and that's going to start for a 65-year-old. And why the spread of difference in premiums? Because it's based on zip code that you live in, marital status, believe it or not, your age and gender. Supplements are going to increase as you get older. We're going to talk about that here in just a moment. But let's talk about how you're covered with supplements. So basically what supplements are designed to do and why they're called Medigap policies is they're designed to cover the gaps in Medicare. And it's pretty much that simple. We've gone over those 5 gaps in Medicare in other webcasts and podcasts, which you can find on our website. You can also subscribe on our YouTube channel and follow if you want to. We encourage you to do that. You've already gotten there. If you're watching this, please go ahead and follow us. Let's start with the number one benefit. We just discussed that with supplements or Medigap policies is they're easy to understand. You're going to pay your premiums and almost nothing else. We recommend basically 2 Medigap policies, Plans N and Plan G. And let me back up for a minute. So Medigap policies are labeled with plans A through N. Currently, there's only 11 plans that somebody can buy who is turned 65 prior to 2020, and only 9 for those who have turned 65 after January 1st of 2020. So the 11 plans are A, B, C, D, F, G, L, M, N, K, and GX. Those are the 11 plans you can buy. There are no fancy names for these. There's no bronze, silver, value, deluxe, gold, whatever you want to call them. Very, very simple. So you can only buy plans labeled A through N. Currently, we are only recommending 2 plans, and that's because they don't underinsure you, they don't overinsure you, and that's letters G and N. So again, with Plan G, you pay your Medicare Part B deductible, which is $198 currently, and nothing else. With Plan N, the same holds true, with 2 exceptions. So with both Plan G and Plan N, once you meet your deductible, you will not pay for blood work, x-rays, CAT scans, MRIs, hospitalization, surgical procedures, chemo, radiation, skilled nursing, diabetic equipment, and on and on and on. You pay nothing. The only difference between G and N is there are 2 small copays with N that you don't have with G. A $20 copay at any physician's office visit, be that primary or specialist, and a $50 copay at emergency room. And that's it. So God forbid, and I don't like to use this example, but again, we have to talk about these situations because they happen. God forbid somebody gets cancer. There's chemo, there's surgery, there's radiation, there's scans. You won't pay 1 penny for that, whether you buy Plan G or Plan N. So those people on private insurance companies that have deductibles and copays and coinsurance, they might have to go to the mailbox every day wondering, oh my goodness, what copay or what bill is going to come in today? What's it going to be? With a supplement, you don't have to worry about that. So that is one beauty of it. Second benefit, as I see them, of supplements is you have the right to go to any doctor or facility in the country that accepts Medicare assignment. It does not matter what company your supplement's with, the doctor or hospital must accept it. So here's where it doesn't matter what company you buy your supplement from. I don't care whether it's AARP. We do business with a company called New Air Life Insurance, which some people might never have heard of. Philadelphia American. Aetna has a supplement company, and they have several names for those. Ascendo, Continental Life. There's companies you've never heard of. There's a company called Lumico. I don't know what a Lumico is. To me, I say it sounds like some sort of Asian fish or something. I don't know what it is. It doesn't matter because you don't call a doctor up when you need a new doctor, if you need an oncologist, an orthopedic, or you want to go to a hospital out of state and say, do you take Lumico health insurance? Do you take ARP? You don't do that. It's, do you take Medicare? Yes, we do. Will you take me as a patient? Yes, we will. Can I make an appointment? Of course you can. When you show up for that appointment, you show both cards, and the provider know exactly what's going on. The provider doesn't actually even bill the secondary insurance company. They're not billing New Era. They're not billing Aetna. They're billing Medicare. Medicare is going to have it on file of who your supplement's with, and they're going to coordinate with the supplement company to get that provider paid in full. So you can go to, okay, if you're watching and you're in Western Pennsylvania, you know we had this big battle between our two largest healthcare providers, Highmark and UPMC. And a couple years ago, there was a big fight, and a lot of people who had Highmark insurance were worried they were going to be cut off from UPMC facilities. Well, if that divorce ever rears its ugly head again, or if that argument comes between UPMC and another insurance company, if you have a supplement, you don't need to worry about it. You can go to UPMC. You can go to Allegheny Health Systems. You can go to Excella Health. You can go to your independent hospitals. You can leave the state and go into West Virginia, which a lot of people in Fayette County do. You can go to the Mayo Clinic, the Cleveland Clinic, Johns Hopkins University. So I've told this tale I don't know how many times. I had a client in 2017, the end of 2017, got a rare parasite from tainted romaine lettuce. UPMC did not have the technology to treat her. Highmark, Allegheny Health Networks did not have the technology to treat her. As great as those two hospital systems are, the only two hospitals in the entire country that could treat her were the Cleveland Clinic and Mayo Clinic. They were each donated a machine, a piece of technology by Elon Musk. She was able to go to the Cleveland Clinic. She stayed for 115 days. She lived to tell about it. I touched that bill. Her husband brought in the bill, or what it would have cost, $250,000, which I actually thought was inexpensive for 115 days in the hospital. She never paid one penny. And more importantly, she had the ability to go there. And I'm going to put it very bluntly. If she wouldn't have, she would have passed away. If she would have had certain HMOs at the time, she would have died. So again, she's 1 in 1,000 that couldn't get treatment at UPMC. Do you want to take that chance? I don't know. Number 3 benefit. Medicare, not an insurance company, decides what's covered. Medicare does not pay people to sit in a tower, in a skyscraper somewhere, and decide when you should leave the hospital, what MRI or CAT scan is medically necessary, what surgery is medically necessary, to give a green light whether you should have a surgery. The doctor steers the ship. I use that term all the time. The doctor steers the ship. In other words, the doctor thinks that MRI is medically necessary. You can have it right now. The doctor can say, hey, Mary, I want you to go to the 4th floor and get an MRI or CAT scan. Now, with private insurance, with Advantage plans or insurance through your employer, that's got to be prior authorized. I'm sure almost everybody who's watching this right now has had that experience. Hey, we'll call you when the insurance company approves that MRI. If the doctor wants you to stay in a hospital another day or two, it's not a problem. So I've had, and listen, it doesn't happen that often with private insurance companies anymore, but it does. I've had clients call me and say, clients' daughters or sons, my father was told he had to leave the hospital, that his insurance company wouldn't cover any more days in the hospital. They weren't paying for any more. He had to leave. Then he went to a skilled nursing facility and told he had to leave there quicker than we thought he would have. That will not happen with a supplement because Medicare is not paying somebody to decide that like private insurance companies are. That's something that is not talked about very often. Number 4, benefit. Benefits rarely, if ever, change with supplements. That is one of the regulations. So supplements are highly federally regulated. One is that benefits can never change. So if you take Plan N, for example, you buy Plan N, there's 3 bills you can have. The Medicare Part B deductible, $20 copay at the doctor, $50 at the emergency room. If you live to be 85 or 90 years old, that's all there will be still. There will still be only the Medicare deductible. Your copay will still be $20 in the year 2041 or 2040, and it'll still be $50 at the emergency room in year 2040. They cannot add copays, and they cannot raise those copays. So in 5 years, Plan N can't say, oh, we're going to make you pay $100 for an MRI now, and now you're going to pay $200 if you go to the hospital. Now you're going to pay $150 if you get a... Cannot happen, period. End of story. So you will always have little or no out-of-pocket cost. Now, that deductible can change. It can and will go up. To put it in perspective, in 2008, when I started in this business, it was $135. 12 years later, it's $198. We have not gotten word yet of what it's going to be in 2021, but you can see it hasn't gone up a whole bunch. I'm predicting that in 10 years, it'll be about $300, which is a drop in the bucket for a deductible. To put that in perspective, we have clients that have $7,000 deductibles right now. That's where we're at in healthcare. So a $300 deductible in 10 years is nothing. Let's move on to the negatives. As I like to say, it's not all sunshine and rainbows with any healthcare plan. The first negative, obviously, of supplements are the cost. I said they start at $80 to $100 for a 65-year-old, and they are going to increase as you age. That is a promise. It's not a matter of if it's going to go up. It's a matter of when and how much. At age 68, Most supplements that we sell are called age obtained. That means at age 68, you're going to get a small increase in premium every year that you get older. It's going to go up between about $2 to $3 a year for the first 10 years, about $8 a year for on years 11 to 15, and then it's going to go up to about $10 to $15 a year on your 20th year and above. And if you live to be 85 or 90 years old, people in that age bracket are seeing their premiums upwards of $300 a month. I did not mention, and I do need to mention also, that supplements do not come with prescription drug coverage. You do need to buy that separately. That's called standalone Part D. Today, that averages about $18 a month. That's the average that our clients are paying. We have about 6,000 clients on supplements today, and they're averaging around $18. Some are paying in the area of $13. Some are paying upwards of $25. But again, that medium average is about $18. Another negative, number 2, is there is no vision, dental, hearing, over-the-counter, or gym membership benefits, which is silver sneakers, that are going to be available with Medicare supplements. With the exception of AARP, they're the only supplement company that provides silver sneakers, which is a gym membership, but that's the only one. Again, no vision, no cosmetic now, vision, dental, hearing, gym membership, or over the OTC. So all medical conditions of the ear, eye, or mouth are covered. So you got glaucoma, cataract, macular degeneration, ear infection, eye infection. If you broke your jaw and needed surgery, those things are covered. We're talking about no cleanings, root canals, fillings, routine eye exam, glasses, or hearing aids. Those are not going to be covered with supplements that are covered with Advantage Plan. The third negative of supplements, they can be medically underwritten. What that means is, other than your first go-round into Medicare, supplement companies can discriminate on you based on your current or previous health conditions. Again, with one exception. When you turn 65 and go on Part B for the first time because you've retired after 65 or due to disability, you get up to 1 year where supplement companies must accept you regardless of your health conditions, where they're not allowed to ask you any medical questions. After that 1 year, sometimes before 1 year too, but up to 1 year. After that 1 year, guaranteed, you're going to have to go through medical underwriting. You're going to have to answer a series of questions. Have you had cancer in the last 2 to 5 years? Heart conditions in the last 2 to 5 years? Do you have COPD? Are you an insulin-dependent diabetic? Do you have AFib? Some of those are automatic denials where you'll never be able to get into a supplement again. This is so important. So many people, when they turn 65, are not given the supplement choice. They're not told that, hey, this is your one and only shot to get into a supplement. I've met far too many people, in the hundreds, possibly over 1,000 people, that have come to see me. They have Advantage plans. I say, do you understand you don't have a supplement? What do you mean? I mean, your plan is not designed to pay the gaps in Medicare. It's not designed to pick up what Medicare doesn't. Well, what do you mean it's not designed to pick up? I mean, it's not a supplement. Well, what do I have? Well, you have an Advantage plan. Well, I don't want that. Okay, I understand that. Let me ask you these medical questions. They answer one or two or more yes. Guess what? They've had an Advantage plan over a year, can't get in one. So that is very, very important. Again, something that's not mentioned very much. We're going to go over the pros and cons of Advantage plans in the next webcast. Stay tuned for that. Log in if you have any questions. You want to make an appointment, you can call one of our offices. Actually, we want you to call our Fayette County office at 724-603-3403, 603-3403. That's just to set up your appointment. We do have office locations in Erie, in Pittsburgh, in the Pittsburgh area, in Forest Hills, and also, again, in Connellsville in the Fayette County area. You call 724-603-3403 to set an appointment with questions. If you want to visit our website or contact me, you can do that. Our website is www.getyourbestplan.com, GETYOURBESTPLAN. You can email me directly if you'd like to at Aaron, AARON, at getyourbestplan.com. This is me signing off on our Medicare Reset Series. Join me again, folks. Thanks a lot. Be safe.